So, you or someone you care about is facing hernia surgery. And if you are, you're probably finding out there are a lot of choices to make. Well, today we're going to break all of that down. We're going to use the latest research to give you a clear roadmap for this journey. Let's get right into it. Okay, first things first, what even is a hernia? You see this clinical definition here, and yeah, it sounds a little complex, but honestly, just think of it as a bulge. That's it. It's when something on the inside of your body pushes through a weak spot in the muscle wall that's supposed to be holding it in. It happens most often in the groin area, and that's what we're going to focus on today. All right, you've got the diagnosis. Now comes the big conversation about getting it repaired. And this isn't about just one single type of surgery. It's really a series of decisions that you and your doctor are going to make together. Think of this explainer as your guide for that journey, helping you figure out the right questions to ask and really understand all your options. The very first, and you could argue the biggest question you're going to face is about using a synthetic surgical mesh. So what is that? It's basically a medical-grade screen that acts like a support patch, a scaffold, really, to strengthen that weak spot and, most importantly, to keep the hernia from coming back. And this brings us to a really crucial trade-off. Look, the data couldn't be clearer. Using mesh dramatically lowers the chance of that hernia returning. I mean, to put a number on it, for every 46 mesh repairs done, 1 recurrence is prevented. That's a big deal. But on the flip side, some people are, understandably a little nervous about having a permanent implant in their body. And while it's less common, non-mesh repairs, where the surgeon just uses your body's own tissue, are still an option, especially if you have specific concerns about foreign materials. So what do the experts say? What's the bottom line? Well, this quote right here from the latest Hernia Surge International Guidelines, which is a global consensus of surgeons, they're pretty direct about it. For the vast majority of patients, a mesh-based repair is the recommended standard of care. And that's all because of how effective it is at stopping that hernia from coming back. Okay, so let's say you've decided a mesh repair is the way to go. The next big question is, how are we going to put it in? And this is where we get to the 2 main surgical approaches, the traditional open surgery versus the more modern, minimally invasive keyhole surgery. I love this analogy because it just makes it all click. An open repair, the Liechtenstein technique, involves one larger cut right over the hernia. It's direct. It's like taking the whole wheel off your car to patch a tire. Now, the laparoscopic approach, like a TAP procedure, uses a few tiny little incisions to insert a camera and tools. That's more like fixing the tire while it's still on the car. It's just less disruptive to the whole system. Analogies are great, for sure, but what does the hard data tell us when we put these 2 techniques head-to-head? Well, a recent randomized trial did exactly that, and the results, well, they paint a very, very clear picture of the pros and cons of each. So let's start with time on the operating table. The open Liechtenstein procedure is definitely faster, clocking in at an average of 73 minutes. The laparoscopic TAP procedure is a bit more complex, so it takes longer, about 95 minutes in this particular study. But, and this is a huge but, here's the flip side, pain. Just 1 day after surgery, the patients who had that longer laparoscopic surgery reported way less pain. Their average score was only 2.2 compared to 3.4 for the open surgery group. And trust me, that's a difference you can really feel right after an operation. And that lower pain level, it translates directly into a faster recovery. In this study, the patients who had the keyhole TAP procedure were usually ready to go home in just 1 or 2 days. Now, compare that to the group who had the open surgery. They needed to stay in the hospital for an average of 5 to 6 days. That's a huge difference when it comes to getting back on your feet and back into your own bed. So, here it is. This is the crucial point, the core trade-off, laid out plain and simple. The minimally invasive laparoscopic approach usually means less pain and getting back to your life quicker, but it comes at the cost of a longer, more complex operation, which means more time under anesthesia. But wait, the decision isn't quite as simple as just picking one technique over the other. Those same international guidelines really stress that the best outcome depends on a bunch of other key factors too. So let's look at those, because we need the whole picture here. First, your surgeon's experience is absolutely critical, especially with these laparoscopic procedures that are technically pretty demanding. Second, the kind of anesthesia you get, local, regional, or general, makes a big difference in your recovery. And third, even the exact type of mesh used matters. For instance, the guidelines suggest a lightweight mesh for open repairs, but a heavyweight one for laparoscopic. It's all about tailoring every single detail specifically to you. Okay, so how in the world do you pull all this information together to figure out the right path for you? The goal here isn't to find the single best hernia surgery, because honestly, it doesn't exist. The real goal is to find the best hernia surgery for you, based on your specific hernia, your health, your lifestyle, and, of course, your surgeon's own expertise.
This is where you become a real partner in your own healthcare. And to help you do that, here are 4 essential questions you should absolutely ask your surgeon. They cover their experience, why they're recommending a certain approach for you, anesthesia, and what your recovery will look like. Having this conversation ensures you're making a truly informed, shared decision.
And that really brings us to our final thought for today. We've compared open versus keyhole, mesh versus no mesh, and we've looked at all these different variables. But as the research points out, again and again, the skill and judgment of the person actually doing the surgery are just so critical. It kind of leaves us with a question, doesn't it? When it all comes down to a successful repair, what matters more? The specific method you use or the master craftsman who's wielding the tools? It's something really important to think about on your path to recovery.